Hi, I'd like to talk to you about what to expect after surgery now. After your hip and knee replacement, we get you up and walking right away. Just a couple hours after the surgery, you'll be up and walking with a walker initially. If you're having surgery at the surgery center, you'll usually go home that same afternoon. If you're at the hospital, you would typically spend one night and then go home the next morning. After you go home for the first week, you're just going to be relaxing. Controlling swelling is the most important during the first week. You'll be elevating your leg, putting ice on it, and doing your ankle pumps. Every hour, I'd like you to get up and walk around your house with your walker, just so you're not sitting on your butt all day. Physical therapy usually starts about a week after surgery, and it's set up ahead of time. You'll either be going to one of our facilities or somewhere close to home. The first 2 to 3 weeks after surgery is usually the worst. After that, things will start getting better. By 6 weeks, most patients are feeling much better. By 3 months, you're probably about 90%. Your first appointment after surgery will be 2 to 3 weeks with my PA, and we look forward to seeing you.